Vyvanse and Midasis went generic last fall, but why are those medications as expensive as the name brand? If you want to find out, stay tuned. Hi, this is GH Glade, and let's talk a little bit about generics versus brand name medications. Generics and brand names share the same active ingredient, but other characteristics such as colors and flavorings that are said to not affect performance, safety, or effectiveness of the generic medication may be different. I find from practice, some people react to these different ingredients. A medication comes off name brand status, the patent ends. The first company to submit an ANDA, which stands for Abbreviated New Drug Application, has an exclusive right to market the generic drug for 180 days. This is called the 180-day exclusivity. Several companies may make the same generic drug and realize that what gets released is the active ingredient and not the process to make it. Different filler ingredient. What this leads to often is different rates of absorption, causing different side effects. But if you're happy with how your generic medication works for you, track the manufacturer. If the appearance of the pill changes, the generic likely has too. Each state has a law that allows pharmacists to substitute less expensive generic meds for many brand names. However, your provider may specify a brand name, and if they do so, that is what must be dispensed. A pharmacist cannot then substitute a generic. Sometimes an acceptable generic is available, and your provider may not be aware of it. And that was the case with Vyvanse when that went generic. Many pharmacists just substituted the generic pretty much automatic. But are they all the same? There was a Canadian study in October 2017 in the issue of Circulation, Cardiovascular Quality and Outcomes that really looked at the value of these lower priced alternatives. It found that patients who took generic versions of 3 different blood pressure medications in the months after the generic drug became available saw increased rates of drug-related side effects. The study authors suggested performance differences between name brand and generic drugs might have been about the same. Now, the FDA defines bioequivalence as the absence of a significant difference in the rate and extent to which the active ingredient becomes available when administered at the same dosage under similar conditions in an appropriately designed study. In order to determine bioequivalence, a random crossover trial is conducted with both the generic drug being assessed and the brand name drug as the control. In these studies, a number of pharmacokinetic parameters are assessed. This is called the PK value, and this includes maximum serum concentration of the drug and drug exposure over time. Now, it isn't a matter of pure potency, and it's true. PK values are required to fall between 80 and 125% of the reference value in these randomized crossover trials. This is the observed PK value. So we talk about potency, but that's not exactly the most precise term. What we notice is that serum concentrations and drug exposure over time may vary between 80 and 125%. So we are talking a potential 45% variability. And I don't know what works in the real world on a 45% variability, but our FDA allows drugs to have a PK value that falls within this range. And as I've said before, it often leads to very different effects for the same medication through different generics. Again, the takeaway here is if you find a generic that works for you, stick with it. Track the generic manufacturer. You can even have your provider designate that they use that particular generic. I do that all the time as a provider. I put it right in the prescription. So the algorithm has not been kind to this website. I would really appreciate it if you hit that like button. And most of all, share it with other people who are facing the same dilemma with the initial high cost of generic meds. Till next time, this is GH Glade for Everyday ADD Coaching. Take care.